Welcome back to Health Check right here, Top TV Look and Live. My name is Grace Mutiso. We are talking about dental health and hygiene in children, and I'm hosting Ruth Gashero Mungai, a dental specialist, and we're looking forward to interacting with you. Our SMS line is 22232. Any question you have regarding dental health of your child, drop them on that SMS line. We'll be sampling them in a short while. Welcome back, Ruth.
Thank you.
You know, you paused us at that point where we must see a dentist.
Yes.
You know, take our children and brush our children's teeth as early as 6 months when the first tooth comes out. So, how do I brush? Yes, of course you told me, but what's the right way now for children over 6 who need to use a toothbrush?
Yes.
How do we brush our tooth properly?
Yes. I want to start from this point, of what our children are taught in schools. There's this song that they are taught that when I wake up in the morning, I brush my teeth, I take a cup of tea, then I run to school.
Yes,
I think that's
that one. Can you imagine?
Do you know it? You know it, I'm sure.
Yes.
And the first mistake get in there, right there, because we are teaching our children that we should brush our teeth before taking our breakfast. Yeah, I don't know how we'll change that, but I think it's something that needs to be worked on, because what should happen, we should brush our teeth after breakfast. Yeah, then brush again before bed. The reason why we insist in those 2 times is because when you take your tea and you go away, the bread that you've taken or any other thing that you know you've taken in your breakfast go acting in your teeth.
Yes.
Or on your teeth, okay? So if you don't brush your teeth, so what happens? The bacteria that we were talking about are active and they start acting on your teeth. Again, number 2 is night. I don't know, most of the time we tend either to forget or we are lazy to or we don't know the importance of brushing our teeth at night. When we do brush our teeth at night, what we do, we prevent our teeth, because at night when we are not active, we are asleep, the bacteria are active. And that's why you'll get, most of the people get toothache during night.
Yes.
I don't know whether you've noted that most of the people have toothache during
the night.
Because at night the bacteria are active. That's why we need to insist on that.
Yes.
While doing my training, I tell them, you'd rather forget to cover yourself with a blanket, but make sure that you brush your teeth. So parents, if you're there, before your children, let them know that it's important for them, you know, to brush their teeth at night and take it as a personal responsibility. Let those habits be with them, in them, you know. We have to talk. I'm saying, Grace, I have to talk about this until when those children, when you go to bed without brushing, you remember, you know, she said about brushing our teeth at night. Because if we brush at night and in the morning, because when we say 3 times, maybe it's not practical that we can do it during the daytime. But if you can, please do. After every meal, you can brush your teeth. But at least insist in the morning and at night.
Yes.
That's very important. So that's number 1 in taking care of our teeth. So brushing morning, night, then how? Yes, we need to brush our teeth the right way. There's the right way of brushing. But before I go to the right way, we need to take 3 minutes, at least, while we are doing our brushing. 3 minutes, yes.
3 minutes?
Yes.
Not 30 seconds?
Not 30 seconds. And I know most of the times we brush our teeth in a hurry. You know, you're late at work and you're doing it as a by the way.
Go on.
I always argue with the ladies and I'm telling them, you need to take more time to brush your teeth than the makeup. And the makeup time, you know. Take more time, do the brushing the right way. Of course, I'll show you how to do it the right way, but that's very important. The other thing we talk about here is toothbrush.
Yes.
How often should we change our toothbrushes? Yes, after every 3 months. Change your toothbrush. After every 3 months, change your child's toothbrush. Why are we changing our toothbrush? Because if you work with your toothbrush for the next 3-4 years, the bristles will wear out and you will not be doing something, you will not be doing work the way it's supposed to be, or the brush will not brush the way it's supposed to brush if you stay longer with it. That's why we should change our toothbrushes after every 3 months. The other thing I will talk about that before I talk about how we should do the proper toothbrushing is that nowadays at least we have what are they called? Electrical toothbrushes that helps now make it easy in brushing.
Yes.
Because when we are doing the brushing, I'll show it with the model, we should do it in a circular motion. But this one does it. The electric toothbrush or the digital ones, they do that work for us, and it's more effective. So if you can grab one for your child, it makes brushing, easier, effective, and fun.
Yeah.
Yes, so those are the things we need to note. And there's another question people ask, what kind of a toothpaste should I use?
Yes, and the fluoride.
Yes.
Amount in it.
Amount in it and all that. And for me, I think the most important thing, because, even earlier times, they didn't have even this toothpaste and all that. But their teeth used to be intact.
Yeah.
Why? Because they used to do more of the brushing. Your old mom and your old grandma would walk with a stick.
Yes, actually they pluck it from the
Yes,
fence,
yes.
chew a bit, and then
Yes.
and they stay with it for a
long time. By the time your grandpa is taking the cows to the water, or wherever they are going, they make sure that they have that stick and their teeth were throughout clean.
Yes.
What about us? You chew a biscuit and you keep going and you even didn't remember to brush your teeth. So those bacteria keeps acting on our teeth. Yes, and those are the things that predispose us in our today's life. So when we are talking about brushing our teeth the right way, if it's okay, I can demonstrate.
Please do.
So this being our mouth, you remember we said we have, for a child, they have 20 teeth.
Yeah.
A child has 20 teeth. Though as they go growing, as they grow on, you realize the teeth keeps adding. So you can get a child has 24 like that. But an adult now, after all your teeth have grown, 32 teeth. Yeah. So when we talk about brushing, we have the upper jaw and the lower jaw. Then we have all our teeth. So we must make sure that we are brushing all our teeth, all the sides. Okay? So this is the way we should do it. We make sure that our brush is touching the gum at an angle. Not like this. Because when we do like this, we injure our gums. Yes, but at an angle so that you do it in a circular motion. Okay. So this angle makes sure that even the dirt, the food particles that are there in the gum where you can't see, they're able to remove.
Yes.
So we do it in a circular motion. And we say a tooth by tooth. You don't double brush your teeth because you'll not brush all the size of each teeth. Okay, so like this. You make sure that you're doing it in a circular motion. So all the teeth should be touched. Then after you're done with the upper side, you go to the inner side. Upper jaw, upper side, upper jaw, inner side. So do the same. Remember, we are doing it in a circular motion.
Actually, as you do that, I'm noticing you're also getting on the joints, like in between the two teeth.
Yes.
The brush is able to get in there.
Yes.
Okay.
That's why we said if we rub like this, we will not be doing a good job. Yeah. Then after that, there is the other very important part.
Yes.
The eating services. And this is where the bacteria attack first. Reason, if you can see, it has deep grooves and fissures. So food tends to hide there. So we make sure that we are brushing them. Put some energy a bit because of the deep fissures. Brush all of them. Then make sure this part we tend to forget. We brush it also, yeah?
Yes.
Then we do the same on the lower side. I know you are wondering where our 3 minutes.
But if you go tooth by tooth, you'll get 3 minutes or even beyond.
Yes, it's true. So we do it the same way. Okay. May I always tell people, take your time.
Yes.
Be keen with your teeth. You will live longer.
Yes.
Because healthy teeth.
Yes.
Yeah, healthy life. Yeah. Yes. So after we are done now with the teeth, they are well done, clean, we go now to the tongue. we make sure that we scrub our tongue.
Is there another a specific way to scrub the tongue?
Yes.
Can you do round or just any style so long as I've brushed the
You
tongue?
can brush it like this.
Okay.
But also you realize in your other toothbrush, it has something here that's called a tongue cleaner. And we also have tongue cleaners. So you just use it and scrub your tongue. Then after that, you make sure you also brush your gums. Softly brush your gums. Now our mouth is clean.
Yes.
Yes. The reason why I have this is called a toothbrushing timer. Because how will you time, or how will your child time that they are doing the brushing the right way? So you can have this, it's a toothbrushing timer. You stick it where they are doing their brushing, and it helps them to do it the right way.
What does it do? How does it exactly operate?
It's a sand dune, so these drops.
Okay. Once the sand is down,
you know you are good. At least 3 minutes you time yourself. And also let me talk about flossing also, because it's very key. Remember, when we brush, we are not able to get in between.
Yes.
So we use a dental floss to get in between the teeth.
Yes.
And again, after we are done with that, imagine all that work, but we are reaching only 30% of our tooth. So deep there, you don't get it with your brush. That's the reason why we send you to the doctor or to the dentist for professional washing or cleaning.
Okay.
Yes.
How often should that be done?
After every 6 months.
If you do it oftenly, you're weakening your teeth. Is that true?
No, not at all. There is no point that we touch the enamel or your tooth. We just do away with the tartar that forms when you eat food and have that dirt in your mouth.
Okay.
Yes.
Is that cleaning also, because you're focusing on children?
Yes.
Is the cleaning of tooth applicable to children, and how is that done?
Yes. Actually, you'll notice that in developed countries, at 1 year or so or two, children should, and it's a must, to be taken to a dentist for that hygiene cleaning. Helps a lot because the doctor is able to get in the deeper parts of your mouth, of your teeth, where you cannot get with a toothbrush. Yes.
Okay.
Yeah.
Thank you. That's clear. I believe my viewer now you have an idea of how to brush your child's tooth.
Yes.
And also yours.
Yes.
If you've been doing it the wrong way, now you know how to do it the right way.
Sure.
So what are some of the signs that a parent should watch out for, that should worry them and let them know their child has a dental issue and they need to take them to a dentist as soon as possible?
As soon as possible.
Yeah.
One, you may not know, especially when the caries and those diseases are in the first stage. That's why we are insisting after every 6 months or once a year, make it a routine to visit a dentist. Before we have issues, we can able to detect them and maybe prevent and protect and treat if they are. But one of the ways to notice that you have issues, if you look at your child's teeth and you realize they are just changing color, maybe from white to yellowish, creamish, just know that we are having tartar. Tartar is something, if I scrub like this, I would remove, area of it. So that's one sign that tartar is in the mouth. So immediately take your child to the doctor and they will get their teeth done their cleaning. So that's number one. Number two, if they have sensitivity, if a child complains of sensitivity, maybe they're taking something cold, and sometimes they may not know, but you can tell a child, take something cold, and they kind of cringe, like you can realize something is happening. That's a sign that something is happening. And of course, the other one is pain. At this stage, even the child will say, or most of them, they may not say, but they avoid eating with that side. You realize when your child is struggling eating or they don't want to eat with that side, just know that there is a problem in that mouth. So take it to the doctor and we will be able to sort this. Maybe in advance, even before it becomes severe, because we said most of these teeth issues, gum issues, they can be prevented in young stages. Yes.
Okay.
Yeah.
And then how are these, the cavities treated in children?
Yes. So when we have cavity of grade 1 or stage 1, stage 2, we do fillings. There is what we clean that decayed part, then we fill it with a material, we call it a filling material, different types of them. Then if it has gone deeper and the child has pain or the tooth is paining, we remove the nerves of that tooth. Then we just make sure that that part is well clean. Then we fill it up. So that's what we call basically a root canal, or in children, we have pulpotomy and all that. So we just make sure that that decayed nerve is out of the teeth, yes. So that's the one way to treat that teeth decay or that. But if they are not so bad, we insist in hygiene. Just make sure that those teeth are clean throughout. It will arrest itself even without doing much. But also now, the reason we keep insisting to go and see the dentist is because the other procedures done that like applying the fluoride, pits and fissure sealants, just to make sure if the child has very deep fissures, the ones we were having a check on in this model, we close them up before they form those decay. Yeah.
And is there a way, now that you're talking about decay, is there a way we can reverse a child who has tooth decay? Or the only option is to lose a tooth?
No, we are not at any point losing the tooth.
Yes.
We say that if you were able to come in early stages, of course now there are other things we say it's beyond repair, you come when the tooth is all gone. So at that point we just have to remove. But our advice is, if this child, you bring them earlier, even before they have these issues, and we detect there is cavity, we are able to prevent that cavity from becoming even more severe and do a filling on that cavity. Yes.
Okay. Yeah. Thank you. I'm hosting Ruth Gasheru, dental specialist. We're focusing about your dental health and hygiene in your children. My name is Grace Mutiso, your host. You're looking forward to interacting with you on any question that you have. Our SMS line is 22232. Let us know what question you have. We'll be glad to answer you.